So the nose with tissues called turbinates filter, warm, and clean the air we breathe. We also have areas where the sinuses drain. We have areas where the tears drain. We have areas where the ear drains, i.e. you pop your ear through your nose. And we have areas high up where we do smell. So the sinuses are a complicated system, and it's a complex system because it is bone, it is mucosa, the skin lining, it has immune cells, and interestingly, a lot of the nerves from our brainstem, the 12 cranial nerves, come out through the sinuses, out into the face. So it's also a conduit, a pathway, and that's why it's sometimes confusing when you have a symptom like a headache. Is that more a headache from muscle tension? Is that a headache from a neurological aspect like a migraine? Or is it headache from having mucus or inflammation in your sinuses? And you got to kind of figure this out, because there is the plumbing aspect, I tell patients, where we as otolaryngologists or ENTs act like plumbers to help the plumbing. Then there's sort of the carpentry aspect where you want to make sure the structures are aligned properly. And then there's the electrician aspect where these nerves, these wires come through through the sinuses, and these wires not only have to interact with the physical components, but the immune system is there, the immune cells. So bottom line, the structure, the physical aspect is obviously critical, but the inflammation and the neural activation, the turning on of the nerves or turning on of the inflammation system, the immune system, this is where issues happen and the symptoms occur. And either using medicine or therapy or surgery or procedures, we can reset this balance. Is to deal with structural issues. Do you have a deviated septum? The center of the nose is bent and you cannot breathe correctly. You have swollen tissues in the nose called turbinates that need to be shrunk down. You have hyperactive nerves that could be, with medicine or with energy or cryotherapy calmed down. Or do you have sinus openings that are too small and they can't drain? We can do endoscopic, minimally invasive surgery to open the plumbing. The third aspect is environment and surrounding issues like poor diet or acid reflux. Because if you live in a place with a really bad environment and the nose is a filter, it's going to have to be, affected by that. Or you have a job, you're in a job where you are in a challenging environment, that can also then really affect you. So allergies, and sinus and nasal breathing and heartburn or reflux or asthma, cough, stuffy ears, droopy eyes. Patients have a lot of different symptoms around nose and sinus. And so you can engage, in all kinds of physicians to help with this, whether it's your primary doctor, it's your otolaryngologist, ENTs, whether it's a pulmonologist, a lung doctor, an allergist, who's also an immunologist. You may even see your eye doctor for eye symptoms. It's fine to enter anywhere into this process, but I would say overall, a practice like ours at SH Medical, we have these various people all together. Meaning we have otolaryngologists, we have allergists, we have the ability to do allergy testing, we have the ability to assess the environment, we have the ability to do a sinus scan and look at the structure and plumbing, and we have the ability to do therapies around all these ideas. And so I would say that a clinic that is multidisciplinary, that can offer these various aspects in one place, is amazing. Always makes sense to start with your primary care doctor and try over-the-counter remedies like the nasal saline or an antihistamine or a nasal steroid spray. And then if you're not making progress, you're not breathing well, you're not sleeping well, you have secretions, you're coughing, you feel tired, you have facial pressure discomfort, and you just feel like you're worn down, and you just are not having clear, easy breathing, then you should definitely go see one of the specialists I recommended. Obviously my bias as an otolaryngologist is to come see us first, because we can assess whether it's a plumbing problem, whether it's a structure, carpentry problem, whether it's an immune inflammatory problem, or whether it's electrical nerve problem, and then we can send you to the right places after the correct evaluation has been done.